about medication versus therapy and what is right for you. Now, many clients that come to me may have been to their GP and been offered medication. Now, I know that absolutely this was something that was offered to me. So when I was experiencing panic and disassociation, what was recommended to me and given to me by my GP was beta blockers, but without any other support. Now, this isn't in the clinical guidelines. It is recommended that therapy is offered and other support is offered with medication, and that medication isn't just the only answer. So you might have found that if you have been on medication or been offered medication, if you've been on medication, that you might have found that it hasn't actually solved the problem. And I just want to talk about this because anxiety is created by lots of different experiences. And if you imagine that the trigger, so for example, as a random example, imagine the trigger for you is driving anxiety because actually you had a accident or a experience in a car that then is now triggering anxiety in your body. You could probably see why medication alone isn't necessarily going to solve that problem or get rid of the anxiety, because the fear is stored within the body. So you can also see, and in terms of my technique and how I work, is medication absolutely has its place, and it's a place where you wanted to discuss that, go to your GP for advice and discussions around medication, but it may not get to, or it doesn't get to the root cause of the problem if the problem isn't solved by medication alone. So when I speak to people and clients that have had medication but they're still telling me that they are still feeling anxious, or they're avoiding situations, or they aren't able to socialise or be present and they're cancelling plans, you can see that medication isn't effective. Now, when you use therapy, so another way of looking at this is when you work with somebody and go through the process of understanding where your anxiety is coming from and actually what you can do to support it. So maybe you learn understanding anxiety, how it works, what keeps it going round. When you learn strategies and techniques and skills to actually manage anxiety in the specific moments in parts of your life where it's going to be really, really helpful, you can see then you start to build confidence and strategies and resources to be able to help you in day-to-day life that goes above and beyond medication and those things. And I'm just being really mindful, I pause there, because I'm being really mindful that I'm absolutely not slating. It has its place, but if you are finding, one, if you've taken medication but you're still not getting the results that you want, or two, you really don't want to take medication as a way of solving this problem, then I want you to know that there are absolutely other proven ways, and ways that I work with my clients with all of the time to help them to overcome anxiety without the need for medication, or as a complement to medication. And then the aim usually is that they will reduce that, because that's what they want, not because I don't tell anybody what to do around medication. So the consequence of believing that the medication will just do its thing, or upping the medication, is that then that this might be a long time solution. Well, not a solution at all actually, because if it's not seeming to help, then this might continue to affect you for a long time. Maybe you're upping medication, but actually the things that are actually causing you the difficulties are the things that aren't being dealt with. You aren't building up an understanding of anxiety. You're not building up skills and strategies to cope with challenges in your life, and you can see then how medication might be limited. But there is an alternative, so you can absolutely access therapy, that can help you to reduce the impact of anxiety on your life overall. And it doesn't have to be long-winded. It doesn't have to be, maybe I'll save that for another story, but therapy doesn't always look like what it looks like on TV. Yes, sometimes we cry, but sometimes if you are listening to this and you're having sessions with me, you will know that sometimes we laugh. We laugh at ourselves, we laugh at the situations, we find alternative ways to deal with it. We don't always delve in the past where it feels really hard and difficult. We focus on the future, we focus on now. So if this resonates with you, so 1, you're taking medication, it's just not working out for you, or 2, you really just don't want to take medication, but you do want to overcome anxiety and you want your life to feel different, then DM me the word anxiety and let's get you some relief. Let's help you to feel more calm, more in control. Let's tool you up with strategies to really help in those moments where you need more than potentially what a pill might be able to offer you. So yeah, I look forward to having a conversation with you. Thank you for those that have joined already. If at times I've paused, it's because it said I've lost connection, so I've tried not to speak within those parts. But yeah, it'll be lovely to start that conversation with you, and I will speak to you soon. Bye for now.